Did you know some tuberculosis drugs not only save people's lives, but also cause permanent hearing loss? Tuberculosis, or TB, is the #1 infectious disease killing a lot of people globally. Especially the advanced form of TB infection caused by bacteria resistant to classical TB drugs is a now global health emergency. To treat this form of TB infection, aminoglycoside injection, in short, drug A, is widely used. Unfortunately, one of the side effects from this drug is permanent hearing loss. So 1 in 4 patients are losing some level of hearing during the treatment and finally living with a disability. There's a less toxic oral drug B named bedaquiline as a substitute for drug A. However, a lot of clinicians have very hard time to decide which drug they should start for their patients, especially in resource-limited settings like South Africa. Because drug B is 4 times more expensive, so it is available only for patients who have high risk for developing hearing loss. But the risk evaluation is solely based on the clinician's expertise without a testing measure to support their decisions. In reality, TB hospitals in South Africa use drug A to all patients at first. If a patient develops hearing loss, then they change to drug B. But by the time hearing loss is detected, it is too late because the damage is irreversible. Now, imagine, what if we can predict who will develop a hearing loss from drug A treatment? Then we can start drug B for patients who are at the highest risk by priority. Therefore, my study aims to develop a hearing loss prediction model based on patients' risk factors before TB treatment. To develop this model, existing clinical data will be used, such as age, gender, HIV, or nutritional status, etc. The model will be a mathematical formula, so clinicians can use this formula to calculate the probability of hearing loss before prescribing TB drugs. Let me give you an example. If a patient received 80% from the model, that means this patient has 80% of chance to experience hearing loss from drug A treatment. For this high-risk patient, we can start drug B to save his hearing. If a treatment-related hearing loss is predictable, then it can be prevented. So we can treat TB, reduce disability, and finally, improve their quality of life. Thank you.